And just a couple housekeeping items. Closed captioning is available, and it is available through the link that my colleague Tessa is putting in the chat box. Our session will be recorded and will be available on the NNLM YouTube channel in a few weeks. Please feel free to put questions in the chat box throughout the session. Make sure that your drop down in the chat box is set to all participants so everyone can see your questions. And I'll just answer all of those questions at the end of the session, but you're welcome to put them in anytime during the presentation. Anyone who is CHES certified is eligible for continuing education for today's session for 0.75 CECH. I do want to note that this is our public health webinar series, so there is no MLA CE for this session. It's CHES only. And if you're not here for any type of continuing education, we still really value your feedback. So please feel free to complete the evaluation at the end of this session. That is also how you claim your CHES continuing education. There will be a evaluation that will open at the end of the session automatically, and we'll also be sharing the link to that evaluation in the chat box towards the end of the session. So please definitely complete that if you're looking for CE, but we really value your feedback even if you're not. And so we'd love to have you fill that out regardless. And I do like to highlight just a little bit about NNLM as part of our public health webinar series, because I know some of you might be here for the first time or may not have interacted with NNLM as much. To give you a brief overview, NNLM is a program coordinated by the National Library of Medicine to ensure that health professionals and the public have equal access to health information. And we support member organizations in our respective regions through different things such as training, funding, and resources. And we maintain a network of member organizations across the country. An organization would be a potential NNLM member if they provide health information to the public. So this means our members are a wide range of organizations, from health sciences libraries and public libraries to hospitals and public health departments. If you're interested in learning more about that, our website is nnlm.gov, and you're welcome to go look for your regional medical library there or find out more about NNLM in general. And like I mentioned, this session is part of our public health webinar series. This is a webinar series for the public health workforce. Although everyone is welcome, most of the information topics are selected to be of interest for public health professionals. And this is a webinar series that is held every other month on the second Wednesday of the month at 2 p.m. We are on the, not on the second Wednesday this month because it was Veterans Day, but typically you'll find it on the second Wednesday of the month. So the objectives for our session today, we'll be talking mostly about a program called Engage for Health. So I aim to talk to you about how you can find this program on the NNLM website, what type of materials are available with that program, and what type of partners are typically involved with it. And I wanted to kick off our session from hearing a little bit from you. And Engage for Health is a program that at its core focuses on health literacy. So if anybody here is willing to share in the chat box how they would define health literacy or how they work with health literacy, I think that would be a great starting off point for our session before we start talking about Engage for Health. So please feel free to share those thoughts with all participants so everybody can see what your definition is of that term. I don't see anything coming through. Oh, here's a few. Okay, yeah, wanted to make sure everybody was hearing me and could find the chat box. But yeah, the ability to make sense out of a myriad of health information that's available, knowing how to identify and locate and utilize health information, managing health information, navigating, addressing health issues on a level that meets the consumer, locate and understand information, how to find quality information on the internet, appropriately framing language for the audience. Those are all really great thoughts, and I think in some way kind of tie into the definition of health literacy, how to communicate, understand, and navigate health resources and tools. Those are all really good answers. And I appreciate you all sharing what your thoughts are on the topic, since we'll be talking a little bit more about it today. So just so that we're all on the same page, I wanted to go ahead and give you a couple of health literacy definitions, and you'll see actually that the two I have here are very similar. The two health literacy definitions, I think, give us insight into the complexity of health literacy and what skills people need in order to manage their health. So the first definition was adopted in 2000 by Healthy People 2010 and by the Institute of Medicine in 2004. And it was updated in 2010 when healthcare reform was passed. So this new definition, the second one you see listed there, only added one word to the previous one, but I wanted to highlight that because I think it's a really important one as far as our discussion today about Engage for Health. So they added the word communicate to have a full definition that says the degree to which an individual has the capacity to obtain, communicate, process, and understand health information and services in order to make appropriate health decisions. And I think a lot of you kind of hit on that when you started defining health literacy in some way in the chat box. Some of you were talking about finding it or knowing good sources. Some of you were talking about how we communicate about information. So I think a lot of you were getting at all different parts of this definition. And health literacy in the U.S., it's complex. I wanted to highlight a few stats here as we get started chatting about this topic. This is from a 2003 assessment called the National Assessment of Adult Literacy. It measured health literacy in those aged 16 and over. And it looked at different tasks in clinical, prevention, and healthcare system type of domains. And the results found that 12% of English-speaking adults in the United States had proficient health literacy skills, so that was the highest level. And proficient was defined as the ability to perform complex and challenging literacy activities. So you can see that there was a pretty big majority that were somewhere below proficient. You know, there were more different levels. It wasn't just proficient and not. There were some middling ones, but only 12% had the highest level that was available on this assessment. Why is that important? I would guess from your really great definitions of health literacy that you shared in the chat box that you could tell me this too. But this is an infographic from the Centers for Disease Control and Prevention. And it shows, I think, why it's important for us to focus on health literacy or address it in our community. And you can see that those with low health literacy are more likely to visit the emergency room, have more hospital stays, be less likely to follow treatment plans. And finally, probably the most serious is that they have higher mortality rates. And so I really like this infographic because I think if somebody doesn't know a lot about health literacy, because it contains the term literacy, we think a lot about, oh, that's like an education or a library type of term or something where it's addressed in those institutions, and it is, but I think it's also important to consider it in healthcare or public health because look at these outcomes. So it's kind of, I think, important to think about how it affects health and the partnerships perhaps that we'll talk about with Engage for Health in a few minutes. And furthermore, research shows us that 40 to 80% of the medical information that people hear during office visits is immediately forgotten, and almost half of the information they remember is retained incorrectly. So I think that in addition to the statistics about health literacy and the associated health outcomes, that it shows us that in general, there might be a need for better communication, especially when we're thinking about medical visits. where somebody needs to remember some instructions as they head home. So what could we do about this? Well, I'm sure many of you know there's likely not one solution to a complex problem. So I'll be talking about a program called Engage for Health today. This isn't the only answer. There's likely a lot of different answers and different issues in different communities. But Engage for Health addresses health literacy through public education. And it's a community education program that was designed to improve the health literacy of the general public. So at NNLM, we call it a program in a box to indicate that all the materials for the program are available on the NNLM website for use by hospitals or libraries, community or faith-based organizations, or others that conduct some type of community program and are interested in using the materials. So that could include public health organizations, which is why I thought it was an interesting one to highlight in our public health webinar series today. And this is a 1-hour program that NNLM developed along with several other partners and pilot tested in Pennsylvania. Engage for Health is comprised of a PowerPoint presentation with suggested speaker notes for a facilitator to kind of walk through with participants what it means to take an active role in their care. And this advice includes things like being prepared with questions for your healthcare provider or taking a friend or family member with you to help you understand or retain the information. Engage for Health also includes a script or a role play type of exercise, which is a mock medical appointment between a healthcare provider and an audience member. And the role play exercise provides hands-on learning opportunity for participants to watch patient-doctor communication and then use the information they just learned to talk about ways to improve the communication that they saw. And this role play frequently uses a guest speaker who's a healthcare provider themselves. There's also a program component within Engage for Health about accessing reliable health information through Medline Plus, which is the National Library of Medicine's main kind of consumer health portal or website for the general public to find good health information, which is why I thought it was great that somebody mentioned in their definition of health literacy that it's finding quality health information because, you know, there are varying degrees of it. So we focus on that communication piece, but also on finding that reputable information. Medline Plus contains information on over 1,000 health topics, and the site is pretty easy to search. It's, like I said, it's designed for use by the general public. And it's also fully available in Spanish, I think, which makes it a great component of a program that's talking about communication. And the program in a box here also includes program evaluations and marketing materials that are all linked on our website for download. And there is a handout for today's class that has a link to the Engage for Health program page. Engage for Health also utilizes these materials from the National Institute on Aging. One is a booklet titled Talking with Your Doctor, and the other is a handout called Online Health Information, Is It Reliable? And these are available to download or order from the National Institute on Aging webpage. They're linked on the Engage for Health program page at NNLM as tools that could be used alongside the program materials. You might be wondering how this program came about or how we recognized the need for this. And I think it's actually a great story about partnership. It wasn't just NNLM deciding to create a program. It was actually something that the Hospital Association of Pennsylvania originally developed back in 2014 as a strategy to meet their strategic plan's emphasis on improving population health and the patient experience. And the Hospital Association of Pennsylvania's clinical staff were using their expertise in a technique called Teachback, which some of you might have heard about, but it's a technique that's often used by healthcare providers to help patients understand. And so they wanted to develop a program that also teaches consumers sort of how to improve their own understanding or be prepared to improve their own understanding of their care. And at this time, the Hospital Association of Pennsylvania was a partner in an initiative from the Pennsylvania Library Association that was called PA Forward. And PA Forward is focused on improving on the 5 types of literacy among Pennsylvanians. So those 5 types of literacy are basic, information, civic and social, health, and financial. And the Hospital Association of Pennsylvania was at the Pennsylvania Library Association annual conference, presenting Engage for Health with a toolkit, and they were also talking about having a list of hospital contacts in different Pennsylvania communities that could partner for that role play activity in case somebody needed that healthcare provider. And NNLM, the Middle Atlantic region, who's based in Pennsylvania, was also there and kind of learned about this program, and they had heard from library contacts that public libraries were interested in having kind of ready-made programs on these different health literacies, the 5 different health literacies, and that they were finding health literacy was one of the harder ones for them to kind of approach or think about how to teach that. And so NNLM-MAR, which is the office that I work in, also saw this program as a way to provide libraries with support to connect with their community hospitals and other healthcare providers. So there was this partnership opportunity, and there was also this opportunity to kind of fill a need that they had heard about. So out of this connection, there was this partnership that formed between NNLM and the Hospital Association of Pennsylvania. And it was kind of a natural partnership because NNLM was interested in updating the Engage for Health program so that it could be used in different types of libraries. And it was also important for them to ensure that the program had an evaluation tool that could be easily integrated into a library programming setting. And NNLM also encourages partnerships between libraries and other agencies. So the role play, including the healthcare provider at the library, was a good opportunity to kind of encourage this type of partnership. And the Hospital Association of Pennsylvania had already invested a lot of time and resources to develop and launch Engage for Health, so they wanted to strengthen the program and continue to kind of share it out with libraries across the state and assist them in connecting to the community partner if they needed it. So NNLM and the Hospital Association of Pennsylvania worked together on some updates to Engage for Health and a pilot project throughout the state of Pennsylvania. The goal of the pilot was to take the program that was already created and incorporate some NLM resources, so that's where Medline Plus got linked in, and create that evaluation tool. NNLM has a national evaluation office who also kind of linked up with this pilot project and helped out with the evaluation portion of the project while the NNLM staff coordinated the update on the actual program. And in this pilot, 17 public libraries in Pennsylvania participated in this year-long project. And along with teaching the Engage for Health sessions in their communities, librarians from these libraries participated in all phases of the planning and evaluation process. So to implement Engage for Health, they were also matched with a Pennsylvania healthcare provider through the Hospital Association of Pennsylvania to help co-present the program and conduct the role play exercise. The pilot project evaluated outcomes for the public and for the involved librarians. And in terms of the public outcomes, you can see here that they were pretty positive. Over 90% of participants in Engage for Health stated that they felt they had improved their ability to prepare for doctor's visits and were more likely to talk with their healthcare providers about their concerns and ask questions if they didn't understand something. And 93% said they had improved their ability to find trustworthy health information, and over 70% said they would use Medline Plus themselves and tell others about it. The project team also hoped that this project would enhance the professional skills of the librarians. And at the first in-person workshop with the 17 librarians from that pilot test group, the project team requested their feedback, and 16 of the 17 said that the training workshop improved their confidence to conduct the Engage for Health sessions, and that the workshop improved their ability to plan similar projects. 15 of the participants said that the training session improved their confidence to develop useful evaluation questionnaires, and that they were likely to apply this to other projects at their libraries. And you can see here the feedback from one librarian who is saying that they really appreciated learning more about the process of program evaluation because, again, then it could apply to other programs or other aspects of their work. The result of this pilot test is the existing Engage for Health program. And like I mentioned, this program is freely available on our website at nnlm.gov. So this is what the program page looks like. And you can see that they are all easy to download and use, all the materials, that is. And like I said, there's a link in the handout for today's class to this exact page on the NNLM website, so you don't have to search for it. But it's on a programming page on the Middle Atlantic region's regional web page. But like I said, you could also select the link in the handout, and we're sharing a link to the handout in the chat box along with a link to today's slides. And something else that I wanted to mention while we're talking about having this program available is that I know many of us are not conducting in-person programs right now, and Engage for Health was piloted a couple of years ago, so it was done in person because, of course, it was pre-2020. And I wanted to mention that, you know, we're well aware that people are also looking for virtual programming ideas. So one thing that I thought I would suggest is that on our public libraries page, which is also linked in the handout, there's a section from different recorded webinars about virtual health programs for the public. And as we have more recordings, they'll get added to that page. And there's also links to the existing recordings on that handout as well. And if you wanted to join any upcoming sessions live, those you can find on our training calendar and register just like you did for today's session. So, you know, you're welcome to review the Engage for Health materials and see if they apply to any virtual programs as well that you might be considering if, you know, because I wanted to mention that I know a lot of us aren't doing those in-person programs now. And I'm well aware that this is, like I said, it's a public health webinar series, so we're thinking about public health professionals and information that they might need from NNLM in these sessions. And I was talking a lot about public libraries in the background. But since this pilot of Engage for Health, we've had different groups use this program in their communities. Last year, we got feedback from a public health nurse who used this program with older adults in her community. And these are all comments that she gave us here about using the program, which I thought was overall great to hear. In terms of the materials, she felt that they were easy to use and adjust for her group. And they also got positive feedback from their participants. She felt they seemed to come away with the main message of Engage for Health and that they were grateful for some of the ideas that were new to them. And she found that people had a lot of questions about navigating the healthcare system or how to get what they needed from the healthcare system, which I personally think shows a need for continued, you know, programming like this. As I think somebody mentioned when we talked about defining health literacy earlier, somebody said navigation or working your way through the healthcare system, and that was what she felt her group was asking about. She found that people were interested to share Medline Plus with their families. And I wanted to, of course, include this feedback from a public health nurse to highlight the use of Engage for Health by public health professionals. Like I said, I've been talking a lot about public libraries, and I absolutely know that I'm at a meeting of people who might be working in public health department or other public health settings. And while Engage for Health is currently available for anyone to implement, it's on our website. You are welcome to download those materials and use them. I think it can be strengthened by including public health organizations. Even though Engage for Health is ready to go in the sense that the program materials are pre-developed, all the things that you see listed here on this slide are things that we might tell a group that they need to consider when they want to run a successful session of Engage for Health. And some of these things, such as space, time, or equipment, might already be in existence at a place like a public library. I'm not speaking for them, but just an idea. Other things such as partners and promotion might be harder to develop or might not just exist there. So this is where I think that public health partners could really come into play here if they're interested in addressing health literacy. One of the things that I think makes Engage for Health unique is the role play component that allows participants to watch an encounter with a healthcare provider and critique that communication between them. And during the pilot program, libraries, like I mentioned, partnered with healthcare providers and were connected by the Hospital Association of Pennsylvania. Some libraries had existing relationships with a healthcare provider, or someone such as an EMS technician, or some new healthcare educator from their community college, so they already knew somebody they could invite, and others didn't. So that's where they utilized that partnership with the Hospital Association of Pennsylvania. But now that the program is freely available for implementation across the country, I think it's important that people consider who they might be able to partner with for that component. Or for some of the other components like getting some promotion out to the community or those type of things. And so I think, potentially, again, I can't speak for everyone, but that public health organizations could be valuable partners in, if somebody like a public health nurse, like the person who offered the feedback on the previous slide, is able to kind of partner to help out with that role play piece or any of the other components. So I think that networking piece is great when we talk about partnerships. And then also marketing and promotion could be challenging. So if your organization as a public health organization has partners who can spread the word or a listserv to promote a session of Engage for Health that might be taking place at a public library, this could increase the number of attendees who find out about health programs and what else might be offered in their community. And libraries often have a lot of programs, health-related and otherwise, that people don't always know about. So it's great, I think, to sort of make that connection and see what else might be available there. And staff is another need. I think this really depends on who's implementing this, whether it's a library or a public health department. But thinking about who's available to facilitate that session along with the healthcare provider can be helpful and can be another way that a public health organization might be able to partner. And I'm talking a lot about what maybe a public health organization able to public library with. But what's in it for public health? You might already know this if you're here today, but I brought up the idea of health literacy as a public health issue earlier. And so, thinking about what health literacy in our communities can do to improve public health is really important. And I think this goes beyond asking questions at the doctor's office, but, if our communities are better equipped to get answers to their health questions, this can hopefully push the needle a little bit on health improvement. And I think, like I mentioned, Engage for Health could be a great jumping off point for future partnerships as well. And outside of this program, library and public health partnerships are a concept nationwide. You can see a few titles here about these partnerships. In 2018, The Nation's Health, which is an APHA publication, wrote about library and public health partnerships, and they were highlighting how libraries as community spaces can support the community's health. And then Preventing Chronic Disease, which is a publication from the CDC, published an article with a similar theme. They were talking about the need for librarians to help patrons with health questions. So I think, it's just a little more evidence looking at why this type of partnership might be helpful. So some of you might have existing partnerships with local public libraries if you work at a public health organization, and some may not. When I'm out talking with the community, I hear a lot of, yes, we have a great relationship, or no, we've never considered it, and everything in between. So I hope if you haven't considered working with a library before, maybe I've piqued your interest as what they offer to you as a community organization. These are really some introductory tips for considering partnership with a public library in your area, and it really could be different where you are. This webinar is available nationwide, so I can't get too region specific. And if we have any public librarians in the audience and they want to offer any suggestions themselves, you're welcome to type those in the chat box. But here's a couple. First, I think this is kind of a given, but it might be good to find out where your local libraries are located if you haven't been there in a while, or if there's more in your community, maybe you frequent the one near your house, but haven't really explored where else they're physically located, and who goes there for information and services. As far as point of contact, some libraries are part of the system. So, for example, where I live in Pittsburgh, the library system has multiple locations in the city, but they have one umbrella that has a programs and partnerships office for the system, where some others might not function that way. So kind of thinking about that, I think, is helpful if you're looking for a partnership opportunity. Some communication tips when you're approaching a public library for the first time are to be clear about what you're asking for. So, for example, are you just saying that you wonder if they have space for you to come in and do some sort of training or program, or are you asking for a promotional table to be set up, or is this something that would recur? You want to see if you can come once a month. Are you asking to speak with an existing group that meets there, such as, maybe a reading club or a book club that already comes, or a group of older adults? Or would this be something where you'd be promoting to your own audience? So I think that's good to think about so that they understand what you're asking them about. And it's also a good idea to ask if they have any health programming at their library already. Some public libraries have a lot of health programs that exist already, so I think it's great to learn a little bit there as well. And I think public library staff tend to have a great idea of what types of programs are of greatest interest to their population. They might have been running health-related programming already and could say, oh, we get a big turnout for this one and not so much for this one. So I think they really can be in tune with kind of the needs of their patrons. And I wanted to highlight just one existing health program that I thought, was interesting and is good to, when we're talking about finding out what already may exist. This is not anything that's affiliated with or funded by NLM. I actually just did a quick Google search myself for programs in Pittsburgh and thought that this was a great example of existing health programs at a public library. This is at the Carnegie Public Library in Pittsburgh. It's called Family Play Shop. Children come to, have a playtime. Again, this was pre-things going virtual, so I don't know the situation currently, but kids were coming for playtime and then there were child development experts that could talk to the parents, and librarians offering information about early literacy. And so, like I said, sometimes we don't know that these type of health-related activities are going on if we're at a different organization, but maybe are reaching the same community or with the same goals. So it's only a quick search or conversation away, I think. And NLM has a lot of other health programming or lesson plan ideas available on our website. You can see a couple of examples here. So Engage for Health is just one of them that I wanted to highlight today as something that will focus on health literacy and communication, and as something that I think is a good public library, public health partnership opportunity. But there's lots of other topics that you can see here. And there's other programming ideas linked in the handout for today's class that are available from NNLM. So that's my contact information. We have a few minutes for questions. Somebody asked from a public library perspective, their local public health department, and probably most are quite overwhelmed right now. Yes, definitely so. And, you know, I think Engage for Health is a topic of interest, but it's important to also know when the right time is for different partnerships. And this might be a time where a public health department is really overwhelmed. Are there other options for libraries to work with? So it really depends on your community. Like I said, you know, with our pilot test, the Hospital Association of Pennsylvania was connecting healthcare providers for the role play, but I think there could be other places that you might find those, whether they're community-based organizations or, you know, if it's like a different association locally. I think, you know, those type of nonprofits maybe could be a partner to look for. I know that a lot of community-based organizations do health type of programs or outreach as well. More of a focus on virtual programming, since we have no ideas when libraries will be open. Absolutely, and so in the handout for today's class, we've had several webinars about library programming and virtual programs. So there's links to all of the recordings from those on YouTube. And also our public library's webpage will be updated as we have more recordings available. Yeah, and so like I mentioned, I'm not, by presenting Engage for Health today, I'm not telling everybody that they should be doing anything unsafe or doing in-person programming, but it is free materials, and so you're always welcome to consider if these materials would work for a virtual program. I don't see any other questions right now. Feel free to type them in the chat. How are public health professionals to message health literacy in terms of counteracting misinformation online? It seems to be the most important challenge of our era. Medline Plus is a good resource, but how can we have a national campaign to share with the public? I think the public is confused on who to trust. That's a great question. I don't know that I really have the answer on the best national campaign around health literacy. I do know that, you know, I follow myself, like the Medline Plus, like social media pages, and I think they do a good job of sharing digestible information or social media type of things for the public. I think that, you know, messaging on understanding health information is always helpful. So within Medline Plus, there is a tutorial called Understanding Health Information, I believe, and it goes through which websites are more reputable and kind of teaches people that type of appraisal. There's also, I believe, linked in Medline Plus is a non-NNLM source, but a tutorial called Trust It or Trash It, which is a similar message about evaluating health information. So I don't know if those would be any good tools to use when we talk about misinformation. We also had a short series recently at NNLM about health misinformation. So we had a series of 3 guest speakers who talked about combating misinformation and related topics. And I could send out the links to those. Those are not linked in the handout, but I could send the links to those recordings as well if you're looking for ideas on that topic. So when I send the recording of today's session out to everybody, I'll link those misinformation webinars in. Somebody mentioned that most hospitals have a community relations department which may be interested in partnering programs. that's a cool idea, and I appreciate you sharing that. So we have about 5 minutes left. If there are no other questions, we can go ahead and wrap up. If you have any other comments or questions, you can drop them into the chat box. I'll hang on for a couple more minutes. You're also welcome to reach out to me via email. Otherwise, you're welcome to go ahead and start logging off if you don't have any other questions. The evaluation, if you're hoping to fill that out, should automatically open when you log out of WebEx, but we'll also drop the link to that evaluation in the chat box. Thanks for coming, everyone. I appreciate you being here.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.